Kita niyo yun? Okay. Smoking is our last topic from the last episode of the doctor's order, no? And we have to correlate this with the most common problems here in society and even the most common illnesses seen in the clinics. So let's start with hypertension. Now, I'm Doc Chris, the Scrubby MD, and here to enlighten you with regards to smoking and hypertension. What I have in my hand is a cigarette. So, pag nakita nyo to, it comes with a pack, no? The pack that also already states na nakakabulag to, nakaka-cause ng stillbirth, nakaka-cause ng katarata, yet we still buy them, okay? Signifies that there is a problem with more on addiction to your cigarette smoking rather than just wanting to take it in, no? So smoking is a huge problem, and smoking, as mentioned last time, it is the single most important risk factor for a lot of the conditions that are present in society. Hypertension, cancer, okay, lifestyle conditions, lahat yun pwedeng mag-relate sa isang sigarilyo. Especially when you smoke at a young age. Now, kaya ako kinokorelate siya sa hypertension ngayon because common ang hypertension sa society. Okay? Let's go to our trusted, not so trusted naman kasi kadalasan ginagamit natin yun para maghanap ng information tungkol nga ba sa isang datos. So let's go to Google. Okay, here is my browser. So chinek ko, nag-search ako with regards to smoking and hypertension. Smoking and hypertension, talakihan lang natin. There are a lot of articles na pwede mong makita online. And not all of them are reliable, okay? So, you have to be, kumbaga, OC para malaman kung ano ba yung reliable na information with regards to the things that you search online. So, pinaka-importante na malaman nyo, saan ba nagagaling yung impormasyon? Okay? So, yung impormasyon nito, nakita natin ngayon, it's coming from the American Heart Association. So, that is the association between smoking and blood pressure. So, siya, nabuksan ko na siya kanina. Tinignan ko na siya kanina eh. So, this is the article. So, pangalawa, aside from looking at the article, check kung kailan siya na-publish. Okay, so for the American Heart Association regarding association between smoking and blood pressure, this was published February of 2001 pala rather. This is authored by Pinatesta et al. Okay, so association between smoking and blood pressure. So, kung ayaw nyo basahin yung buong article, there is also a simpler way para malaman nyo kung ano ibig sabihin, ano ba yung content nito. Okay, aside from that, bakit tayo dito nag-take ng information? Kasi these are based on studies. Studies, hindi siya chismis. Okay, hindi siya galing lang sa kapitbahay, hindi lang siya galing sa tropa mo na, ito masarap mag-sigarilyo, try mo to, hititin mo. So dito, this is more on scholar studies regarding to health, okay, towards health, towards hypertension, towards the use of cigarette. Okay? So for this one, we look at the abstract, which is usually the gist of the article. So on the start, cigarette smoking causes acute blood pressure elevations. That is proven kasi each time you take a smoke or a cigarette, you elevate your blood pressure. Now, that only lasts when the stimulant is present. Now, think for example, nagsigarilyo ka or nag-take ka ng smoke, nicotine is in your body, okay, and other components of your cigarette, elevated ang blood pressure. Pag nawala yung content, okay, na metabolize na, bababa yung VP, normal na. Now, paano magpalagi ka? Okay, you're a chronic smoker from years past. Let's say, sabi mo, 10 years smoker. Okay, kung 10 years smoker ka, napansin na ng katawan mo, na lagi may times na tumatas lagi ang BP ng taong to. Siguro yung BP niya na is hindi na siya yung dati. So, mag-a-adjust ang katawan mo with regards to your usual BP. Let's say your usual BP was 110/80. Ngayon at naninigarilyo ka, may times na nagsaspike siya. You smoke, let's say, 5 cigarettes a day or even half a pack or 10. Okay? Pag sinabing pack, that is 20 pieces. Okay? Kapag, let's say, half a pack, 10 pieces of cigarettes in one day. Tapos, let's say, for example, nagtitake ka nun, tapos yung effect nung isang cigarette is usually 30 minutes. Ganun. So, matagal yung pagtaas ng BP mo. Pag napansin niya doon, mag-a-adjust yung katawan mo and it would eventually cause, okay, a sudden shift of your blood pressure, causing it to have a higher blood pressure or specifically yung systolic blood pressure. Kaya ka nagkakaroon ng hypertension in the long run. Now, sabi niya dito, not all. Okay? Kadalasan kasi, if the study started with participants at a young age, hindi mo pa masyado siya makikita. Now, that does not conclude na okay lang manigarilyo ang mga bata. Ang problem dyan, kapag mga bata na nigarilyo, okay, those young adults, they tend to adapt it when they grow old, okay, tumatagal yung exposure mo sa cigarette. Pag tumatagal yung exposure mo sa smoke or smoking, the chances are, mas mataas din ang exposure mo sa chemicals nito, leading to hypertension when you grow old. Okay, so medyo problem din yun, problematic yun pag tumanda ka. Okay? Now, kapag matanda naman at naninigarilyo, okay, syempre, tapos hypertensive pa siya nun, mas magiging problem yun. Okay? Kasi tataas ang BP mo, you will have BP spikes. Okay, ano pa sabi dito sa article na to? So, this was done with a cross-sectional data for 3 years and an annual health survey for England were used to investigate any differences of BP of smokers and non-smokers with adults of greater than 16 years old. So, ano pa nabanggit dito? Older male smokers and had higher systolic blood pressure adjusted for age. So, meaning, tumataas ang blood pressures nila, especially systolic blood pressure, meaning yung upper value ng your BP. Okay, and then kung lalaki, okay, male smokers. So may risk factor ang males that are smoking, pero that does not excuse females, okay, na pwedeng manigarilyo, okay? Mas mataas lang ang risk. Pareho kasi lang may risk, pero the higher the risk is among male individuals, okay? Now, ano pa? Age. Okay, sabi ko nga kanina, let's say when the study started, normal pa ang BP kapag bata pa. Okay, once the child or the person grows old at na-maintain niya yung paninigarilyo, well, eventually, your BP will catch up. Tataas yan. Okay? So, it will have a higher systolic blood pressure once the child grows old. Now, BMI. There is a study that with regards to smoking, it promotes plaque formation. At the same time, appetite stimulant din siya kadalasan kasi parang pagkatapos mo man kumain ng madami, naninigarilyo ka, di ba? Parang sabi pa nila, pampagana. Now, BMI, with regards to smoking, kumbaga it causes a chain of events na it would further promote a more unhealthy lifestyle. Okay? Social class. Pag napansin nyo, during the siguro 2000s, parang feeling nila stig ang naninigarilyo, ganun, di ba? Left and right, may naninigarilyo. Even the advertisements with regards to smoking is somewhat conveying a social class. Di ba? Nalala mo yung cowboy na nagkakabayo. Tapos, ang advertisement lang is cigarette smoke or cigarette, di ba? So, sabi parang high class, parang social. Or parang, nakaka-attract ba to ng women? Ganun, for the male audience, di ba? Yung mga iniisip nila. Pero, actually, that doesn't convey reality. Smoking, it leaves a smell in your clothes, it leaves a smell in your breath. At the same time, nagkaka-stain, ang mouth stains. At the same time, your fingers would get stained. Okay, so I'm not sure if with regards to being a smoker, it would be somewhat ideal, kumbaga, no? Hindi siya not necessarily, pero social class kadalasan, kung may pera, yun din, nakakabili. Pero minsan kasi pag mga may mahirap din sa buhay, or people living below poverty, minsan sila pa nga yung madalas manigarilyo, di ba? So, that depends on if it's a higher class or in a people living in poverty. Pero here in the Philippines, if you would see the setting, those people living in poverty are commonly publicly seen smoking, and wala silang masyadong health awareness with regards to the effects of smoke. So that is bothersome. Next, alcohol intake. Kasi side by side to eh. Cigarette history and alcohol consumption. So kadalasan, kung meron kang smoker, meron ka din alcohol use. So yan, medyo kwan din. Kailangan din natin mabantayan. Kasi hindi lang sa paninigarilyo, yung complications, pati yung pag-aabuso ng alak, magiging problem sa liver. Okay? Now that is with regards to what the American Heart Association says, no? So among men, men have a higher risk, okay? Significant interaction between their BMI and BP association. Sa women, merong BP difference between non-smokers and light smokers, pero yung non-smoker, not that much with regards to men. Pero at the same time, both of them have risk with regards to smoking. Okay? Between men and women, this association is likely due to the complex interrelation among smoking, alcohol intake, and BMI. So, these three, smoking, alcohol intake, and BMI, would interact with regards to what the risk or the effects would happen in your body. Okay? Kasi syempre, if you're abusing cigarette smoking, and then at the same time, kasi pag umiinom ka, sabay din naninigarilyo ka, you're abusing also your liver with regards to alcohol consumption, and even your body, which is the body does not need that much high levels of alcohol. It's just a kumbaga pastime or leisure time lang ng isang tao para uminom ng alak, which is not really recommended, no? BMI, okay, for BMI, well, once you smoke, once you have alcohol, there sometimes it causes you to feel lax or relax and lessen your physical activities, okay? And at the same time, yun nga, yung plaque formation with regards to that has a higher risk for coronary artery disease or atherosclerosis. And pag nagkaroon ka din ng plaque formation, well, it will narrow the blood vessel. It will cause more elevations of blood pressure. So yun, it would eventually cause a unhealthy lifestyle. Okay? So that is smoking with regards to the American Heart Association. Now, tignan natin yung mga ibang articles. Mabilisan lang. Medyo naka 14 minutes na ako regarding dito. Okay, here. So, from the up-to-date, ay, sarado pala. Next time na yan. So, from up-to-date, so trending, worldwide, the absolute number of cigarette smokers increased because of population growth. Kasi affordable lang siya and nabibili siya kung saan-saan. Okay? So, you could see here, yeah. In the US, the estimated number of cigarette smokers had decreased, result of tobacco control efforts. Malaki ang matitipid ng isang country with regards to controlling cigarette smoke and the healthcare itself. Okay, pero there's an emergence of e-cigarettes. We'll discuss e-cigarettes in another video, siguro sometime, no? Hookah smoking, hindi ko pa siya masyadong narinig to. Ano pa ba? Okay, cigarette smoking and blood pressure. The effect of cigarette smoking on blood pressure are complex, with the evidence that smoking increases blood pressure acutely, like what the American Heart Association mentioned earlier. and increases the risk of renovascular malignant and mass hypertension. So, kagaya ng sinabi dun sa plaque formation, kung yung plaque formation na yun ay nag-occur sa, let's say, sa renal arteries, yung mga ugat sa may kidneys mo, it would cause hypertension or renal hypertension. Kapag renal hypertension na naman naging problem mo, well, kapag kidneys ang problem mo, it would cause end-stage renal disease or what you call your CKD. So, it's a side effect of your hypertension. So, be worry kapag ganun. Ayaw nyo naman siguro mag-dialysis, no? So, quit smoking na, no? Tingin pa tayo sa iba. Okay, this one. Okay, this is an article from Verdis. This was published last 2010. Okay. Okay, yan lang natin. Okay, public PubMed. So, sa baba. Hypertensive smokers are likely to develop severe forms of hypertension, including renovascular hypertension. Okay? An effect likely due to the accelerated atherosclerosis. Like what we said earlier, yung plaque formation. So, yung plaque formation na yan, that is very, very crucial. Okay, kapag yan ay nag-maintain at hindi yung nagtigil manigarilyo, it will eventually it will eventually affect your blood flow of your kidneys, causing it to shut down and might cause renal failure. Okay? Ano pa ba? Well, how to quit smoking? Siguro with this, I will try to make a separate video with regards to how to quit smoking. Medyo matagal na yung video, so I hope may natutunan kayo with regards to smoking and hypertension. Okay? So in summary, syempre, sana yung sigarilyo. Pag ito, nagamit mo ng matagal at hypertensive ka, well, yung normal BP mo, hindi na siya magiging normal. Okay? Yung 110/80 mo, eventually magiging 120/80, magiging 130/80, magiging 140/80, 150/80. Now, if yung BP mo ganun kataas, this also what you call a substance that can also promote plaque formation in your blood vessels, causing atherosclerosis. Now, kung yan ang nangyari sa may renal arteries mo, okay, magkakaroon ng narrowing ng blood supply sa kidneys mo, okay, sa mga bato. Kapag nagkaroon ng narrowing, magkakaroon ka ng renal injury, and eventually, it will lead to one of the complications of hypertension, which is an organ damage of the kidneys, or what we call your chronic kidney disease. And in the end, ano bang nangyayari kapag may chronic kidney disease? Well, if damage is irreversible and you've already reached stage 5 of CKD, well, you're only a candidate for renal transplant or dialysis or hemodialysis or even peritoneal dialysis, which is a bothersome, especially kapag if you caught it at a young age. Sayang naman yung lifestyle, quality of life mo kapag winaste mo lang yung life mo with regards to just a pack of cigarettes or just single stick. So at an early age, don't try. Don't try. Okay? Anyway, that's enough for my video, and hopefully may naintindihan kayo, and thank you for watching and listening. This is Doc Chris, the Scrubby MD, and we're signing out.